Good morning, I am Teju. Today we are on a special series of Diabetes Par Charcha in Hyderabad studio along with our renowned endocrinologist Dr. Neelaveni from Usmania Medical College, Hyderabad. Ma'am, we would like to have a special introduction about you to our viewers.
Namaste, I am Dr. Neelaveni, Professor and Head Department of Endocrinology at Usmania Medical College, Hyderabad.
A small question for you. So, what are the normal blood sugar levels?
So, normal individuals will have a fasting and we measure by at 2 times basically. So, in the fasting state and 2 hours after eating. So, normal is in the fasting state when the fasting is defined as after last meal should be more than 8 hours. So, that is the fasting state. So, suppose if you have taken the meal in the night somewhere around 8 o'clock, you can have the test done at 7 o'clock or 8 o'clock. So, then it should be less than 100 milligrams per deciliter. And after 2 hours of eating, so it should be less than 140 milligrams per deciliter. So, this is normal.
Okay, so how do we test diabetes at home?
Testing diabetes at home you can do with glucometer. So, even in the institutes, like even in the diagnostic centers also it can be done. So, if it is high, you have to go for a proper venous blood sampling, like where we draw the venous sample, then test for it. Anything like in the fasting state, if the blood glucose levels are more than 126 milligrams per deciliter, it is diabetic state, or 2 hours postprandial, it is more than 200 milligrams per deciliter, it is diabetes.
What can I do to prevent diabetes?
So, especially type 2 diabetes is a preventable disorder. So, type 2 diabetes is because of the lifestyle, it is a lifestyle disorder, it can be prevented. So, if it can be screened early, like it has to be screened basically, that is why there is a concept of screening for the type 2 diabetes. So, people who have a family history of diabetes, who are obese, who are sedentary, who have hypertension, who have high cholesterol levels, women with gestational diabetes mellitus or women with PCOS, these are all the high risk categories. They have to be screened, and age also is one of the risk factor. So, anybody nowadays, previously it used to be more than 40 years, now it has to be screened after 35 years of age. So, if you screen and based on the screening result, if you can categorize into normal or abnormal or diabetic status. So, abnormal is the pre-diabetic status. So, if you can in the sense follow the lifestyle measures, like for an obese individual, if you can reduce the weight, at least 5 to 7% of the weight reduction is good enough to bring back them into the normalcy. So, it can be prevented with appropriate lifestyle measures, at least 5 to 7% of the weight reduction with appropriate exercise techniques. It can help us to prevent the diabetes.
Thank you, doctor, for your valuable insights to our viewers. Our viewers will definitely benefit from this. For more information about diabetes and management, do follow our page Diabetes Par Charcha on Facebook. Also, we are also available on Instagram, Twitter and YouTube. Stay connected. Thank you.
Thank you.